Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Today we're going to talk about something extremely important, especially if you're over the age of 60. Millions of people take medications every single day to manage pain, allergies, sleep problems, heartburn, and even colds. These medications can be helpful when used correctly. But what many people don't realize is that some very common pills, some you can buy without a prescription, may quietly increase your risk of heart attack or stroke, particularly as you get older. As we age, our metabolism slows down, our blood vessels stiffen, and our heart becomes more sensitive to changes in blood pressure, fluid balance, and inflammation. This means medications that were once safe can become risky if taken too often, at the wrong dose, or for too long. Today I'm going to share 5 of the most common pills that cardiologists watch very closely in adults over 60. I'll explain the science behind them, who should be cautious, and what safer habits you can adopt in your daily life. Let's get started. Every day, millions of people over the age of 60 reach for a simple pill to relieve pain, reduce inflammation, or just get through the day. But what if that small, routine decision is quietly placing enormous stress on the heart, building risk with every dose, every week, every month? What most people don't realize is that some of the most common over-the-counter medications, trusted, familiar, and easily available, can silently increase the risk of heart attack and stroke, especially in aging bodies that no longer respond the way they once did. Take a moment and think about this. Medications like ibuprofen, naproxen, and diclofenac are used by millions every single day, often without a second thought, often without a prescription, and often without understanding the cardiovascular consequences that can unfold silently beneath the surface. These drugs belong to a class called non-steroidal anti-inflammatory drugs, NSAIDs, and while they are incredibly effective at reducing pain and inflammation, their impact on the cardiovascular system is far more complex and far more dangerous than most people are ever told. Inside your body, these medications work by blocking enzymes known as COX-1 and COX-2, which are responsible for producing prostaglandins, chemicals that promote inflammation, pain, and fever. But these same chemicals also play a critical role in maintaining healthy blood vessels, proper kidney function, and balanced blood flow. When you disrupt this delicate balance, something dangerous begins to happen. Blood vessels can start to constrict. The kidneys begin to retain sodium and water. Blood pressure slowly rises, often without symptoms, often without warning. And as pressure builds within the arteries, the heart is forced to work harder, pumping against increasing resistance, placing strain on a system that may already be vulnerable due to age-related changes. Scientific studies have repeatedly shown that regular use of NSAIDs can increase the risk of heart attack and stroke, even in individuals with no prior history of heart disease. And the risk becomes significantly higher in those over 60, where arterial stiffness, reduced kidney function, and underlying inflammation are already present. What makes this even more alarming is how quickly this risk can begin to develop. Research has found that cardiovascular risk can increase within just weeks of consistent NSAID use, meaning that what starts as a short-term solution for pain can rapidly evolve into a long-term threat to heart health, and it doesn't stop there. These medications can also make the blood more prone to clotting, reducing the body's natural ability to keep blood flowing smoothly through narrowed or aging arteries, increasing the likelihood of a sudden blockage that can trigger a heart attack or stroke without warning. Imagine this for a moment. A person wakes up with knee pain, takes a pill to ease the discomfort, and continues this routine every day, believing it to be harmless, believing it to be safe. Yet inside their body, blood pressure is creeping higher, fluid is accumulating, and the heart is slowly being pushed beyond its limits. There are no immediate alarms, no obvious symptoms, just a gradual, silent progression toward a potentially life-threatening event. This is what makes these medications so dangerous, not their immediate effects, but their hidden cumulative impact over time. For older adults, the risk becomes even more pronounced because the body's ability to metabolize and eliminate drugs slows down with age, allowing these compounds to remain active in the system longer, amplifying their effects on blood pressure, kidney function, and vascular health. At the same time, many individuals over 60 are already taking medications for high blood pressure, diabetes, or heart conditions, and NSAIDs can interfere with these treatments, reducing their effectiveness and creating a dangerous imbalance within the body. In some cases, NSAIDs can even blunt the protective effects of certain heart medications, making it harder to control blood pressure and increasing the likelihood of complications. This creates a perfect storm where multiple risk factors converge silently without the individual ever realizing the growing danger. But here's what's even more shocking. Many people assume that if a medication is available without a prescription, it must be completely safe. That assumption can be deadly because safety is not just about the drug itself. It's about the dose, the duration, the individual's health status, and how the medication interacts with the body over time. And when these factors are ignored, even the most common pill can become a serious threat. But there is another side to this story, one that empowers you, protects you, and gives you control over your health. Because the goal is not to eliminate these medications entirely, but to use them wisely, carefully, and only when truly necessary. The first step is awareness, understanding that frequent or long-term use carries risks that must be respected, especially after the age of 60. The second step is moderation, using the lowest effective dose for the shortest possible time, rather than relying on daily use as a long-term solution. And the third step is exploring safer alternatives that can reduce pain without placing additional strain on the heart. Simple lifestyle strategies like regular movement, gentle stretching, improving joint mobility, maintaining a healthy weight, and using heat or cold therapy can dramatically reduce the need for pain medications while supporting overall cardiovascular health. Even something as basic as walking can improve circulation, reduce inflammation, and strengthen the heart, addressing the root causes of pain rather than just masking the symptoms. Because true healing doesn't come from suppressing pain, it comes from restoring balance within the body. And when you begin to make these small but powerful changes, something remarkable happens. You reduce your dependence on medications, you lower your cardiovascular risk, and you give your heart the support it needs to function efficiently, even as you age. The truth is, your heart is incredibly resilient, but it is also incredibly sensitive to the choices you make every single day. And sometimes, the smallest choices, the ones that seem the most harmless, can have the greatest impact over time. So the next time you reach for that pill, pause for a moment and ask yourself a simple question. Is this helping my body or quietly harming it? Because your awareness today could be the very thing that protects your heart tomorrow. Every year, as the cold and flu season arrives, millions of older adults reach for a simple remedy to clear a blocked nose, ease sinus pressure, and breathe freely again. But hidden inside many of these familiar cold and allergy pills is a powerful chemical that can send blood pressure soaring within minutes. For someone over the age of 60, that sudden spike in pressure can be more than uncomfortable. It can be dangerous, unpredictable, and in some cases, life-threatening. The medication at the center of this silent risk is a group of drugs known as decongestants, including common ingredients like pseudoephedrine and phenylephrine, found in countless cold, flu, and sinus products sitting on pharmacy shelves around the world. These medications are designed to shrink swollen blood vessels in the nasal passages, allowing air to move more freely and relieving the pressure that makes breathing feel difficult. But the same mechanism that clears your nose also tightens blood vessels throughout your entire body. And when blood vessels tighten, blood pressure rises, sometimes quickly, sometimes dramatically, and often without warning. Imagine this scenario. A 65-year-old wakes up with a severe cold, reaches for a decongestant to get through the day, and within an hour begins to feel their heart pounding harder than usual, their face slightly flushed, their pulse racing, but they assume it's just the illness, never suspecting that the medication meant to help them is placing intense stress on their cardiovascular system. Inside the body, the heart is now pushing blood through narrowed arteries, working harder to maintain circulation, consuming more oxygen, and placing strain on blood vessels that may already be stiffened by years of aging, cholesterol buildup, or high blood pressure. Scientific research has shown that decongestants can increase systolic blood pressure by several points in a matter of hours. And for individuals with hypertension, heart disease, or a history of stroke, even a small increase can significantly raise the risk of a cardiovascular event. What makes this risk especially dangerous is that many older adults are already living with conditions that make their cardiovascular system more fragile. Conditions like high blood pressure, diabetes, kidney disease, or coronary artery disease. In these individuals, the margin for error is incredibly small. A slight change in blood pressure can be the tipping point that triggers a heart attack or stroke. And yet these medications are often taken without hesitation, without guidance, and without awareness of the hidden stress they place on the heart. Another shocking reality is that decongestants can also stimulate the nervous system, causing the release of adrenaline-like chemicals that increase heart rate and tighten blood vessels even further. This combination, faster heart rate and higher blood pressure, creates a dangerous environment inside the body where the heart must work harder while receiving less oxygen-rich blood. Over time, repeated episodes of elevated pressure can damage the inner lining of blood vessels, making them more prone to inflammation, plaque buildup, and clot formation. And when a clot forms inside a narrowed artery, the consequences can be sudden and catastrophic. A blocked artery in the heart can trigger a heart attack. A blocked artery in the brain can trigger a stroke. Both can occur without warning. Both can change a life forever. What makes this situation even more concerning is that many cold and flu medications contain multiple active ingredients, meaning a single dose may include a decongestant combined with pain relievers, antihistamines, and caffeine-like stimulants, amplifying the stress on the cardiovascular system. For older adults who are already taking medications for blood pressure or heart disease, these combinations can interact in unpredictable ways, reducing the effectiveness of life-saving treatments or causing sudden spikes in blood pressure that are difficult to control. And here is a fact that often surprises people. Even individuals who have well-controlled blood pressure can experience dangerous increases after taking a decongestant because these medications act directly on the blood vessels themselves, bypassing the body's usual regulatory mechanisms. In other words, the heart is forced to respond instantly to a sudden change it cannot easily counteract. That is why cardiologists and medical organizations consistently warn older adults to use caution with decongestants, particularly those with a history of hypertension, heart disease, or stroke. But awareness alone is not enough. Action is what protects the heart. The good news is that there are safer ways to manage congestion without placing unnecessary strain on the cardiovascular system. Simple remedies like saline nasal sprays, steam inhalation, warm fluids, and proper hydration can help loosen mucus, reduce inflammation, and restore comfortable breathing without altering blood pressure or heart rate. Even something as gentle as breathing in warm steam from a bowl of hot water can open nasal passages naturally, providing relief while allowing the heart to remain calm and stable. Maintaining a healthy lifestyle also plays a powerful role in preventing severe congestion in the first place. Regular physical activity improves circulation and strengthens the immune system. Adequate sleep supports the body's ability to fight infection. Balanced nutrition reduces inflammation and promotes faster recovery from illness. And staying well hydrated keeps mucus thin and easier to clear, reducing the need for medication. These small, consistent habits create a protective shield around the heart, allowing it to function efficiently even during times of illness or stress. Because the truth is, the heart is not just a pump. It is a delicate, hardworking organ that depends on stable pressure, healthy blood vessels, and balanced chemistry to keep the body alive. When that balance is disrupted, even briefly, the consequences can be severe. That is why the decisions you make during something as common as a cold or sinus infection can have a profound impact on your long-term health. The pill you take today can influence your blood pressure tonight. The pressure in your arteries tonight can influence your heart tomorrow. And your heart tomorrow determines the quality of your life in the years ahead. So the next time congestion strikes and you reach for relief, remember this simple truth. Not every fast solution is a safe solution, and protecting your heart is always more important than clearing your nose. Every night, millions of adults over the age of 60 lie awake in bed, staring at the ceiling, watching the clock tick slowly forward, feeling the frustration of another sleepless night. And in that moment of exhaustion, many reach for a small pill, believing it will bring peace, rest, and relief. But what few people realize is that some of the most common sleep medications can quietly alter brain chemistry, slow reaction time, and increase the risk of falls, heart rhythm disturbances, and even stroke, especially in older adults whose bodies are more sensitive to these powerful drugs. Medications like diphenhydramine, zolpidem, and diazepam are widely used to treat insomnia and anxiety, and for short-term relief, they can be effective, but their long-term effects on the aging brain and heart can be far more serious than most people imagine. As the body ages, the liver and kidneys slow down, meaning medications stay in the bloodstream longer, sometimes lingering through the next day, dulling reflexes, clouding judgment, and weakening coordination in ways that are not always obvious until it's too late. A person may wake up feeling slightly groggy, slightly unsteady, slightly slower than usual, but that small delay in reaction time can be the difference between catching yourself during a stumble and falling hard onto the floor. And falls, especially after the age of 60, are not minor accidents. They are one of the leading causes of hospitalization, disability, and death in older adults, with hip fractures alone carrying a mortality risk that rivals many serious diseases. But the danger goes deeper than broken bones. When sedative medications slow the nervous system, they can also suppress breathing during sleep, reducing oxygen levels in the blood, and placing additional strain on the heart and brain. Over time, repeated episodes of low oxygen, known as nocturnal hypoxia, can trigger inflammation, disrupt heart rhythms, and increase the risk of stroke and heart failure. This is particularly concerning for individuals who already suffer from sleep apnea, high blood pressure, or cardiovascular disease, conditions that are common in people over 60 and often undiagnosed. Imagine the heart as a tireless engine working through the night, pumping blood to every organ, every tissue, every cell. And now imagine that engine being forced to operate with less oxygen, slower signals, and increased stress while the body lies unconscious and unable to respond. That silent strain can accumulate night after night, gradually weakening the cardiovascular system until a sudden event occurs without warning. Scientific studies have shown that certain sedative medications are associated with an increased risk of stroke, cognitive decline, and memory problems in older adults, particularly when used regularly over long periods of time. These drugs can interfere with the natural sleep cycle, reducing deep restorative sleep, the stage when the brain clears toxins, repairs cells, and stabilizes heart rate and blood pressure. Without adequate deep sleep, the body remains in a state of low-grade stress, releasing hormones that raise blood pressure, increase inflammation, and accelerate the aging of blood vessels. In other words, the very medication taken to improve sleep may actually be preventing the body from achieving the kind of sleep that protects the heart. And then there is another hidden danger: confusion and disorientation. Sedatives can impair memory and judgment, causing individuals to wake up during the night feeling unsure of where they are or what they are doing, increasing the risk of wandering, falls, and accidents in the dark. A simple trip to the bathroom can become a dangerous journey when balance is compromised and reaction time is slowed. One misstep on a slippery floor, one missed handrail, one moment of dizziness. That is all it takes to change a life forever. But here is the most alarming truth of all. Many people continue using sleep medications for months or even years without realizing that the body can develop tolerance, meaning the same dose becomes less effective over time, leading to higher doses, stronger drugs, and greater risk. This cycle can quietly trap individuals in dependency, where stopping the medication suddenly causes rebound insomnia, anxiety, or restlessness, making it feel impossible to sleep without the pill. And yet, despite these risks, there is hope, real, practical, life-changing hope, because the human body has an extraordinary ability to restore natural sleep when given the right conditions. Simple daily habits can reset the body's internal clock, improve sleep quality, and protect the heart without relying on medication. Exposure to natural sunlight in the morning helps regulate circadian rhythm, signaling the brain when to be awake and when to prepare for rest. Regular physical activity during the day increases the body's natural sleep drive, allowing sleep to come more easily at night. Limiting caffeine in the afternoon prevents stimulation of the nervous system when the body should be winding down. Keeping the bedroom cool, dark, and quiet creates an environment that encourages deep, restorative sleep. And establishing a consistent bedtime routine trains the brain to recognize when it is time to rest, reducing anxiety and promoting relaxation. These changes may seem simple, but their impact on health can be profound. Better sleep strengthens the immune system. Better sleep stabilizes blood pressure. Better sleep reduces inflammation. Better sleep protects the heart and brain. The goal is not to eliminate sleep medications entirely, because in certain situations they can be helpful and necessary under medical supervision. The goal is awareness, understanding that long-term or unnecessary use carries risks that must be respected, especially after the age of 60. Your heart, your brain, and your body depend on the quality of your sleep more than you may realize. Sleep is not just rest. Sleep is repair. Sleep is recovery. Sleep is protection. And the choices you make tonight, whether to rely on a pill or support your body naturally, can shape your health for years to come.